I was just reading something real small. I do need the glasses for small writing. Everyone all set? All set? Okay. Good afternoon. Thank you for joining us here today as we provide another update on COVID-19. And I want to thank everyone for being here today. We've been giving them about once a week. And as we've seen in the last few weeks, we've seen some numbers that have unfortunately gone up with regards to COVID-19 on a weekly basis, and we're starting to see lately some numbers go up with regards to a daily basis. And before I go into the presentation, I want to give you the latest numbers for yesterday, which we got just before I came upstairs. For November 3rd, there were 3,320 diagnostic tests received by the Erie County Department of Health. There were 167 new cases, for a rate of 5.0. Not good. Not good at all. So it's not on the screen because we just got this just beforehand. But once again, it was 3,320 total tests received for November 3rd, 167 new cases for a rate of 5.0. Not including the cases that I just talked about. But the cases through November 2nd, we had 13,752 positive cases, with out of 574,734 total test specimens received at the lab. Here's a very distressing point. 728 people have died. That's 11 since October 26th. Most, but not all, died in a Erie County Hospital. It's my understanding that all but one was over the age 70 or older. One was in their 50s. But this is the most deaths we've had in months, I believe. 11 deaths. So my deepest condolences to the family and friends and loved ones of those who've unfortunately deceased from COVID-19, including these most recent individuals. And of course, as we've talked about before, these are all lab-confirmed cases. In other words, they were positive before death. There's no presumed positive cases with regards to the cases that we do, or for that matter, the deaths. On November 2nd, there were 92 individuals admitted to Western New York hospitals for COVID-19, of which 42 of them were in Erie County. 14 Erie County patients were in the ICU. 11 had an airway assist. We'll go through those data as we often do. The Western New York totals, you'll see that the bar graph dating back all the way to March when we were at our highest for Western New York, and we've creeped back up at least into the low 90s. 92 individuals in, I should say Erie County Hospitals, I should say Western New York hospitals, 20 in the ICU. And then we have this amount, the 42 in Erie County hospitals, of which 14 of them were in the ICU. 11 required an airway assist. And you can see the bottom graph of the last 7 days, there were 6 individuals who died in an Erie County hospital from COVID-19, which is the highest amount we've had in any 1 week period in quite some time. We'll not be taking questions now. We'll take them afterwards. I'm going to turn it over to Dr. Burstein to go in through some of the diagnostic tests and positivity numbers we've seen lately. We're not going to give you all the data we always have in the past because a lot of that is just duplicative, but we do have some key data that we want to share with you. So, Dr. Burstein.
So good afternoon. So these are data looking at all the specimens that were tested over the past 6 weeks, the number of confirmed cases of those tested, and then the proportion of positive tests. So you can see that just in the past week, we've had a huge jump in the number of cases and the proportion of positive tests, where we've had almost an 80% increase just in the past week. So we're seeing many, many more cases now. It's it's not a good time, and we are seeing these cases from a variety of situations and from a variety of zip codes. So these are the zip codes where our top 10 number of cases we're seeing in positivity rates. So you can see that every week it's different, and a zip code can have a low number, and then all of a sudden they can just pop up. And when we're looking at what the sources of these are, even though there is a high proportion of positive tests in many of these zip codes, investigating these zip codes, many times they're family clusters, several households where multiple people in the house are positive. A lot of these are related to schools and higher education, colleges, universities. Many times, or people we know in those age groups. So there are a few in nursing homes. Really, the vast majority are from people in the community, either from in households, and then many of the positives are in the college age group or primary grades age group. So. Again, none of these right now meet the criteria for yellow, orange, or red zones. However, we are following this very, very closely and working with our state partners to help them understand, where are the source of all these cases. So as I alluded to earlier, we're seeing the sources of these cases from a variety of situations. We're seeing them from schools, we're seeing them from colleges and university. We're seeing people who report to us a travel history and then test positive. We're seeing a lot of cases in sports teams, both youth travel leagues or college, university sports teams. So we're seeing a lot there, and we're seeing money among households. One person tests in a household, even a child could test positive, and then we test the other members of the household, and pretty much everybody's positive. So it spreads very, very quickly in a household. So we just want to remind Erie County residents that if there's somebody in your household that is in isolation or quarantine, you really need to adhere to that concept, because the infection, COVID-19, can spread very, very quickly within households. So you really may have to make sure that that person in isolation or quarantine, stays in their room, doesn't come out to rummage through the refrigerator, or and when they do use a common bathroom, that they really need to disinfect afterwards. We're seeing transmission in households. And again, we're not really seeing any single source of transmission from all these cases. They're just from a variety of places in our community, from a variety of situations. So no place is safe. You really always have to think about keeping the numbers small where you go, wearing your mask, physical distancing as much as you can, and washing your hands. So just want to talk about the cases that we're seeing in schools. And here I'm talking about grades pre-K through grade 12. So just in in October, we've had this really explosion of number of cases that we have seen in schools. And it's not just with students. I know that everybody thinks that it's it's the students who are identifying as positive. We're seeing more than a third of the cases among school staff, and just and so you might think oh, that's not that much. However, when you think about the makeup of a school, the vast majority of people who are in that building are students. So a third of the cases of being staff is a very high proportion of the people who are are staff in the schools, because usually in schools, maybe 10 or 20% of all the people in a school are staff, but here a third of all the people who tested positive in the school are staff. So we're seeing a lot of transmission among staff, and that's staff who are not just transmitting within the school. We're seeing staff going outside and school grounds and socializing, and that's where many of them are getting infected too. So we've just before October, in September we only saw about 10 cases in schools, and since the beginning of October we've seen 215 cases in schools. So it's really escalated. So schools are a place that we're looking at too. So if people are concerned that they could have been exposed and they want to get testing, or they think they might have been infected in the past and they want to know if they have antibodies, they can call our Erie County Health Department hotline at 858-2929 to schedule. So again, this is no cost for the people who are being tested, and you don't have to bring any type of lab requisition or physician's order. This is available to New York State residents only, so people coming in, traveling from out of state who want to test are not going to be eligible for testing. We're using New York State tax dollars to pay for residents of New York State to get tested. You don't have to have symptoms to get tested with our regular PCR tests. However, with our ID Now tests, for people who are in person, either staff or students in grades pre-K through 12, you do have to be symptomatic. However, for our regular PCR testing, you do not need to have symptoms. So Ben, all of these are by appointment only. So if you want a regular PCR test or an ID Now, if you attend school for any reason, you have to call 858-2929. We're also doing antibody testing. We're just doing this weekly. The next test is at the Sheridan Park Fire Department. We're also offering free flu vaccines, so anybody coming in for a test who also wants a flu vaccine, we're happy to do that. And for the antibody test, you can just walk in. You don't need to schedule an appointment. It's helpful for us to know what to expect. However, if you're in the hood and you want to get an antibody test, please stop by. So the New York State has issued new travel advisories that I'm sure that the media has been reporting on, and your listeners have been trying to understand. So it is a little bit complicated, and I can walk you through it. So first of all, we know that all states outside of New York State, even the contiguous states of Pennsylvania, New Jersey, Connecticut, and Massachusetts have high rates, and as well as other states. So we are strongly discouraging travel to any state outside of New York State for any reason. If people are entering New York State from those non-contiguous states, they still have to quarantine for 14 days. However, the state is giving an opt-out option for the 14-day quarantine. So in order to qualify for that, first of all, for no matter if you're out of the state for more than 24 hours, even just for 2 days, you have to have a test done within 3 days before you return to New York State. So say you were in Ohio for 2 days, say you were in Ohio for a week, so within 3 days before you return, you have to get some type of diagnostic COVID-19 test. You don't have to necessarily have the results back, because the results can take a week or so or more, and if you're getting the test in another state, it can be difficult for us to obtain those results. However, you do have to have that test done. And then when you return, you have to quarantine for 3 days, and then on the 4th day, you can get a test. And then you have to remain in quarantine until you have that second negative test result. So when the second test result is negative, then you can leave quarantine early. So the tricky part is if you're out of state in a non-contiguous state for just like 2 days, so more than 24 hours, and also more than 3 days, you'd have to have the test done in New York State within 3 days of your planned return, and then retest again 4 days after you do return. So it's a little bit confusing. However, all the information is on the New York State Health Department's guidelines. So the essential travel has not changed. So if you're an essential worker, you again coming into New York State, you do not have to quarantine. However, you do need to get a test. So if you return and you want to, if you're in the airport, the state has National Guard stationed to collect your travel forms, and those will be given to the state health department to follow. If you return by car or train or bus, then we would like you to self-report, and the state is going to follow up with all the travelers. So we have a link on our website to the New York State travel form. So we would like people to self-report about their travel. And did you want to say something? Okay. So now we'll talk about Erie County, how we respond to our epidemic.
Before we go into Erie County Sprons, I neglected to once again identify and thank Kendra Schmidt from Deaf Access Services for being here and providing the American Sign Language. She spent a lot of time here over the last 7 months, and I thank her for being part of our team. With regards to the travel, just one little thing about that. I was not supposed to be here today. I had originally been assigned, and I was going to be an elections poll watch inspector attorney in Michigan. I was going to be in Adrian, Michigan, in Lenawee County, overseeing the vote on behalf of the Democratic Party there. I last week said I can't go because of the quarantine restrictions. If there had not been a quarantine restriction, I probably would have traveled to Michigan to protect the vote, but got to set a good example, and I did not go. So just there's a lot of folks who were, I know for the election, wanted to travel to other states and did not because of the issues associated with COVID, and the numbers in Michigan were quite high, and there's a reason why the quarantine is in place for a state like that. So I didn't go, and we're also, is once again, discouraging folks to avoid these other states, especially the ones that have some very high numbers. The Back to Business program, Monday was the last day to apply. There were 5,022 applicants who seeking a combined total of $97,280,000. We have $20 million set aside. So we're not going to be able to pay out every party that applied and the amount that they were looking for. 43 North is our partner in this, and their reviewers are starting the review and approval process now. We expect an announcement of grants at least 2 weeks. It's going to take at least 2 weeks. The goal is to hopefully have everything set and the money out the door by December 1st. The Back to Business grant program certainly was very well received by our members of the small business community. I want to thank those who applied, and it just goes to show the need that still exists and why we need additional federal assistance to help our local business community just as they need it elsewhere across the country. The Live Well Erie CARES Act Rental and Mortgage Assistance Program, we have $10 million set aside for that. As of November 3rd, it's 2,209 applications were received. I think it's the number somewhere a little off there, but we do know that approximately $5 million has been requested in rental and mortgage assistance, of which the vast majority of it, or about 10 times as much, is in the rental category over mortgage. And applications are still available and being taken by 211WNY.org. You can call 211. But you must apply by November 15th. And once again, our goal is to get the individuals and parties approved, whether it's rental or mortgage assistance, and the dollars out the door by December 1st. Flu vaccine, just a reminder that the flu is starting to creep up in our region, as it is across the country. And you can get flu vaccine at pharmacy and doctor's offices, free flu vaccine. Clinics from the Erie County Department of Health, including select Buffalo Public Schools, will be coming soon. You can go to our website at erie.gov/flu to find out more about that. And you can also find the closest location to where you live to get a flu vaccine, such as a pharmacy, by going to vaccinefinder.org. Finally, I want to thank the staff from the Board of Elections as well as the election inspectors. The Board of Elections staff is still going to be busy for quite some time. But I do want to thank all because it looks like we have one of the largest turnouts in Erie County history. We thought we were going to have it, and we certainly did. As of yesterday, the reported votes to the Erie County Department of our Board of Elections, there were 381,437 votes that were cast in the presidential race. In early voting and through yesterday's general election vote, there were, as of close of business yesterday, 80,954 absentee mail-in ballots that were received back by the Board of Elections. So that's combined is approximately 74% of the enrolled voters in Erie County. And we do know that there are still over 10,000 absentee ballots that could be sent back. We don't know if they all will, but they could be. They have time. I don't believe they actually start counting until approximately November 16th because of the rules associated with military ballots. New York rules are you have to have it postmarked by Election Day. If we have a serviceman or woman who's in, let's say, the Persian Gulf, and they drop it in the mail and it's postmarked with the military mail, as of yesterday, there's still 13 more days in which their ballot can be received. So the absentee ballots, the mail-in ballots have not been counted yet. There's still some races that could be determined as a result of that. Numbers will certainly change in every race, and so that's why you've seen some races called and others not. I want to thank the Board of Election staff as well as the part-time elections inspectors for running this election at a very difficult time of COVID. It was different. We certainly saw a change in the habits of our voters with so many of them. Approximately 18% of the voters actually have returned an absentee mail-in ballot of what will be the final total. And I'm just impressed by the people of Erie County for coming out. We all know when it comes to the presidential election, New York's not a swing state, but we're still having a very high turnout. I was looking at the numbers associated with Milwaukee County in Wisconsin, which we all know is definitely a swing state, and Milwaukee County's huge. Milwaukee's a little larger than Erie County, but I think when all is said and done, our vote total is going to be almost identical, and our percentage is going to be very similar. So I think it's a testament to the people out in our community who voted, and it certainly is a testament to the Board of Election staff, as well as the part-time elections inspectors who worked during early voting, as well as yesterday to provide a safe mechanism for people to vote and for hundreds of thousands of Erie County residents for coming out and voting. So thank you to all. With that, I'll entertain questions. Michael.
As a UB grad, is the football game tonight a good idea?
The question was, as a UB grad, is the football game tonight a good idea? We do not have any evidence of COVID-19 positive tests on the football team at this time. There was issues with UB earlier. We talked about that, UB Sports, but they have put in a very, very regimented protocol. And since then, we really have not gotten any cases from the University of Buffalo. We have had some cases associated with Canisius College and their sports teams. So I think UB cracked down very hard. And having talked to President Satish Tripathi, his response was, I am not going to let University of Buffalo get shut down and go virtual because of sports teams not being able to control themselves. And they controlled themselves since then.
You're bringing somebody in from Michigan, though.
Huh?
You're bringing the other team in.
You know, it's no different than the Bills games because they're basically being locked down. It's not like they're going out into the community, other team from outside the area. It's no different than when we had the Blue Jays here. The teams would come in, they'd basically be locked down in the hotel, they go to the stadium or the baseball field, and then they'd leave. So it's really not that different. If the teams that were coming in from Michigan, whether it's Western Michigan, Eastern Michigan, my law school alma mater, University of Toledo, if they came in and then they were going to a hotel and then they were partying in town, I'd say, no, we can't do this. But my understanding is they come in, they are, if they go to a hotel, and sometimes they don't, sometimes they drive in and drive out, but if they go to a hotel, they're locked in, they can't leave. So it seems like good protocols are in place at this point. And if we were to say no UB football, then you'd almost have to say, well, why are we allowing professional sports at the same time with the NFL? I think Marley was next, then you, Michael.
When was the last time we were at 5% in Erie County? I feel like it's been months.
The question was, when's the last time we were at 5% in Erie County on a day? I don't know. We just got this information before, so we didn't actually have a chance to look.
Back in the spring.
Yeah, it's been a while. Probably May, maybe June. but it's been a while. We'll have to take a look, but we'd have to go through all the data to determine that. Michael?
Regarding the Bill Stadium, I know the decision to allow fans in is not yours, it's the governor's, so I'm going to preface that. But I'd love to get your thoughts on this idea that the stadium would not be safe to allow fans in. Social distancing, you have that option. I mean, is there a place in...
Michael, I really can't, I can't offer anything with regards to the football stadium. We've talked about this, and I'm not going to, I'm just, the governor's talking about it. At this point, governors, until the state says it's going to be allowed, it's not allowed.
Is there a safer place, in your opinion, than going to an outdoor Bill Stadium?
Well, as we talked about before, it's not just about sitting in the stands, it's going in the concessions, using the restrooms. How do you clean the restrooms between use?
Limited fans.
Yeah, but even limited fans. What if somebody is sick and they use a facility? I mean, it's in the state's hands, and right now they don't feel comfortable. And to tell you the truth, when we got a 5% testing rate, where we've had 3% over some of the most recent days, that's bad. It's not good. I'm not happy about it. None of us are happy about it. But as I've said before, as long as the numbers are going up, there's no way there's going to be fans in the stadium.
Are you
get-
advocating one way or another, or are you just
No.
saying no?
Okay, you had mentioned there was an 80% increase in COVID-19 cases. Since when?
Since
Yeah, why don't you come up here? The question was, there was an 80% increase in COVID cases since when?
Thanks. So the data that we were, whoops. Yeah, position?
She grew.
How did that happen? So the data that I was showing.
You just passed it.
Oh, thanks. So the data I was just showing is last week, so the week ending October 31st, we've really had, you see, the proportion of positive tests was 2.4%. The week prior to that, the week ending October 24th, the proportion of positive tests was 1.3%. So that's an 80% increase. We're seeing a lot more. And really, remember, our testing results are reflective of our community's behavior. So this is something we could have control over. If people are going out, if they mask, if they stay into small groups, if they we're even seeing transition within small parties. So that's nothing safe. So try to hunker down, stay indoors, stay with your immediate family. If you're gonna do something like, fun, you can go out, take a walk. If you wanna do it with your friend, wear a mask, be outside. But please, think twice about traveling. Think twice about going to gatherings, especially gatherings inside. And if you do go out, please wear your mask all the time. Stay as far away you can from other people, and please wash your hands. These numbers are reflective of our community's behavior.
Andrew, you have a question?
I had a question about the zip code 14212. That's had a pretty high positivity rate for a couple of weeks in a row now.
Yes.
So I'm curious to know if we see another week with numbers like this, could that zip code move into either the yellow or orange zone? And in general, we are seeing some of the highest percentage of positive COVID-19 cases that the county's seen since the beginning. And I'm just interested in, you've spoken to this a bit about your level of concern about this, and whether or not this follows your expectations, because I know that there had been some discussion about seeing another outbreak in the fall.
Okay, so to answer the questions, a few questions. What's going on with 14212? And we worry that this will get into a red, orange, or yellow zone. And then, in general, commenting about our high number and high proportion of positive tests. So, 14212, has seen some higher numbers this past week, and then the prior week, they were over 6%. So that is a concern. Again, the state has specific criteria that each cluster has to meet to, what the state is identifying as a microcluster has to meet those criteria to turn into a colored zone. So it's not only the, the proportion of positive tests, it's the number of tests, it's the 7-day rolling average, it's the, it's the population positivity rate, and then also looking at the circumstances. Is it like kind of general community outbreak, or is it just isolated to a few households? Because these are, some of these zip codes don't have a lot of people living in them, so any number of cases can result in a high proportion of tests. So the state is looking at all of that, and we are concerned. However, right now, as far as we've been told by the state, is none of those zip codes meet all the state's criteria to get into one of these colored zones. However, that can change anytime, and again, we're working very close with our state partners to to try to get ahead of it and be prepared. And just looking at the overall number of cases and the proportion of positive tests, that is very concerning. And as you know, all the public health experts have been telling us that to expect pretty much, doom and gloom with COVID-19 this winter. We do expect, according to our public health officials, to see higher numbers this winter because, people are doing more indoors. We can't take advantage of outdoors as much with many of the activities that we did over the summer. People are experiencing prevention fatigue and not masking as much and still participating in gatherings, large gatherings, small gatherings, any gatherings. People are traveling to contiguous states, and so even though they are not bound by the travel restrictions from New York State Health Department, we're still seeing cases return from those states, people turning positive after return from those states, and that is including youth sports, so that's affecting the schools. The number of cases that we've had in the schools have been high, and then the number of contacts that has caused is even higher. We probably had about 1,000 contacts in the schools over the past month. So it's been really difficult, and you know that some schools have had to close because they just didn't have the staffing capacity. So it's going to be a difficult winter, and it's up to us to try to change that course by masking, trying to avoid travel as much as you can, even to Pennsylvania for whatever reason. Making sure that you're trying to avoid any type of gathering outside your household, physically distancing when you can, and washing your hands. I think that county executive wants to.
Anything in the back, Kelly first.
To clarify, the 5% positivity rate that just came in, was that for Erie County or the 5 counties?
That's
in
Erie
general?
County.
So it's just Erie County. And then, what else can you guys do to make people take this seriously? Because, these numbers are going up, and just, unfortunately, I'm reading the comments on Facebook and Twitter, and people don't seem like they care.
Well,
can you find people, or what? What
The
can
issue
you
is,
do?
what can we do to get people to take this seriously? I'd say the vast majority of people in Erie County are taking this seriously. There's a very vocal minority, and all you got to do is look at this graph I just put back up on here, where we had 6 deaths in the hospital over a 7-day period, and during that 7-day period we had 11 deaths countywide. And had that in a long time. And we see the rates going up. I don't know how many people I saw on social media write, well, the pandemic's going to end as of Election Day. The pandemic is not ending as of Election Day. Actually had one of our highest numbers reported the day after Election Day, which occurred on Election Day. So to those that are going to be deniers and hoaxers, you're hurting the rest of the community because you're the ones that aren't wearing masks, who aren't caring about it. It's serious. We continue to need to, and I thank the media for getting the message out about what we're dealing with, because we need you to get the message out. But I also need, there's no two sides on this. This is not a reference to your thing, but there's no two sides. There's COVID. There's not non-COVID. It's just COVID. It's out there. And for those who deny it, that is not a rational point of view. It is not an argument. The science trumps the opinion. The science is based on the facts. So for those that go out there and say, oh, this is all, you heard the plandemic, there's no plan here. You think I really want to be dealing with this for 9 months now? Do you think Dr. Burstein want to be dealing with this for all these months now? None of us wanted to be dealing with this. This was supposed to be my easy year. I got reelected last year. This is going to be the year it's going to be easier. I was going to get out and golf more. I kept on hearing from people earlier in the year because the only thing they could do was golf. They're golfing. I'm in the office 12 hours a day. And for the record, I don't get overtime. I get paid the same amount, no matter how many hours I put in. So this is not something that I wanted. This is not something the governor wanted. And for those that are deniers out there, you're hurting our community. We need people to take this seriously. And to see these numbers going up, especially if I go back this one, you can see the bar graph and how high it was. It goes down and it stayed down for a long time. And then we heard it's probably going to go up in the fall, but we can control it if we do the right things. And now it's going back up. And what have we said all along? First you get the cases. Then you get the hospitalizations. And then a couple weeks after that, you get the deaths. Look at that bar graph. We're talking a couple weeks from when that bar graph really started to shoot up that we started getting the deaths. This is serious. And unless we take it seriously, we're going to have continued growth. Jean?
Now, some people in my newsroom have been wondering, with these cases going up, this 5% positivity, do we face a chance of getting completely shut down like we did back in March?
The question was, do we face a chance of getting shut down like we did in March? And I say the answer yes. Not that we want that, but yes. Look what's happening in Europe right now. It basically shut down again for a whole month in Great Britain and in France. And they're 2 weeks to a month ahead of us. And I know from talking with the state officials, including the Lieutenant Governor, I have not talked to the Governor in a bit, but to the Lieutenant Governor and others, they're worried. They see the Western New York numbers, they're worried. They don't want to shut down. We've all said that. We don't want to shut down. We want to find a way to keep our businesses going. But if we got back up to the point where we were at 10 or 12% infection rate and hospitalizations in the 200s, especially with what we're seeing now with hospitalizations across Western New York. 92 COVID-19 patients in Erie County hospitals, but in Western New York hospitals, but only 42 of them are in Erie County. 46% of all Western New York patients are in Erie County. The rest of them are in Niagara, Chautauqua, Cattaraugus, and Allegheny. And they're reaching their limit. They're going to be reaching their limit soon. We're getting their cases. Some of the other areas, Erie, Pennsylvania was getting their cases. We're worried that if the hospitalization gets to a point where we start reaching that point of no return, where we basically have to stop non-essential surgeries, like happened in the spring, and just use those beds for COVID patients, that's a bad thing. Could it happen again? Yeah, I can always say yes, it could happen. If we do the right thing, it won't. Marley, I know you had a question.
So we keep on saying avoid any type of gatherings. Obviously, the one thing on many people's minds at home is Thanksgiving is in less than a month. Christmas and Hanukkah and all of those celebrations are coming up. People don't want to hear that you can't gather, but what is your message to them as we're seeing this high infection rate?
The question was, what is our message to the public with regards to the gatherings that'll be coming up for the holidays? And the answer is, it's preferable not to gather. If you're in your family unit, yeah, have Thanksgiving in your family unit, but don't bring the family from California. Nevertheless, bring the family from Pennsylvania here. It's just going to transmit COVID. And you don't know unless you have had multiple tests in a short time whether people have it in your family or not. And as Dr. Burstein noted, we're seeing a lot of family transmission where one member of the family tests positive and then the whole rest of the family tests positive. And unless you have one member of the family who's probably sick and that's why they get tested, you don't know about the other members of the family. So we're very worried, and we're recommending, once again, like the state is recommending, to limit gatherings of all kinds, and when it comes to future holidays, to avoid gathering with other individuals that you have not been around, because there's a greater chance of getting COVID. Next.
With the increase in hospitalizations, what conversations have you had with the local healthcare companies, and could we see a return of, say, St. Joe's as a COVID-only hospital?
I have had a few conversations in the hospitals as of at least a week ago, felt pretty good with regards to their current condition, though they were seeing cases coming from the southern tier. Our Erie County numbers have stayed fairly stable. There's been some up and down, but fairly stable. I am been worried for quite some time now about the hospitals in the southern tier that are COVID-19 patients. We are talking with them. If Dr. Burstein wants to come up and say a few words, she can, because she also has conversations with the chief medical officers of the hospitals. But in general, I think we're okay right now, but if this rate keeps on going, we could be talking a month from now. That's what I'm really worried about. I'm not worried about the next week. But as the case rate goes up, hospitalization goes up. As hospitalizations go up, deaths go up. We've been seeing this case rate go up for basically a month now. And the hospitalizations went up. And now the deaths are going up. So we're going to be watching this for quite some time. Did you want to add anything here? Okay. I think Sandra, you were next, and Michael.
I could ask a question about the back to business grants. You had previously said that after everyone who, after the deadline has passed for the rent and mortgage assistance program, and I'm not sure about the child care program, that money, if there is any money remaining in those accounts, that they may be swept into the back to business grant program because it is so popular and there's such a need. Just wanted to see if that is still your plan, and also curious to know who makes the final decision regarding which businesses get grants.
First off, the question was regarding back to business. Will we be adding additional money if we have it to the back to business program? It's still our plan, but it's a matter of ensuring that we have appropriate funds for the other things that we've confirmed, as well as whatever additional cost we'll have. I mean, we're really low otherwise. We're basically $1 million unallocated, which we have to keep there for just something that might pop up out of the air. So right now, it is my intention to allow additional money to go in, but we're never going to be able to meet the whole entire demand based on the requests. And the actual reviews and decisions are going to be made by 43 North and the reviewers. The county will not be making individualized decisions. 43 North reviewers will be going through to determine actually if the individuals qualify, if the businesses qualify. We think that there's quite a few that probably won't qualify due to the restrictions that were put in place. We've had some that we know that have applied from Niagara County, Genesee County. They're not going to qualify because it's only an Erie County program. But 43 North and the reviewers will be doing the review and approval process because we wanted to take the politics out of it. We didn't want people to think, well, Mark Poloncarz or legislators were deciding where the money went to their favored businesses. I don't even want to know, truthfully, who applied. I don't, because I don't want anyone to accuse me of saying, oh, you gave money to this group, but you didn't to that group. So 43 North, and that was a decision we made early on, with its reviewers, will be going through the process and making the approvals, and then they provide us the data. Here's who we approved and how much money and why. I think, Michael, you were next.
Yeah, following up on something Sandy asked you about, you must have some pretty good data now from the tracing of the people who become infected. Are you finding some areas where the rate is high because these are people who have to go to work every day? You know, are you seeing real good numbers about the people who live in each of those zip codes?
The question was regard to contact tracing and whether we're seeing kind of good numbers and being able to correlate one positive case with another. I'm going to turn it over to Dr. Burstein to answer that question. I really don't know the answer to that. Though, as we noted earlier, there doesn't seem to be any one driving factor on the increase, which means it's community spread.
Thanks. So the question is, can we make any type of comments about who's getting tested and who's being diagnosed?
Can you draw some conclusions after, almost 9 months, that in the rate in some areas is driven because, 14215, people have to go to work every day, that sort of thing.
Great. So the question is, why may we be seeing higher numbers in some part of the counties compared to others? Well, I think again, this can be looking at our COVID numbers is also reflective of our social determinants of health. So if a large number of people live in a small space, very close together, and if someone's sick, they may not have a safe place to isolate or quarantine. or they work in a job and they're, they're afraid they may not be eligible for COVID pay, and so they try to, work through their illness. This is why we may be seeing higher numbers in certain zip codes, just because there's crowding, multi-generational families living in households, and people are also people in those many times people in those areas are essential employees, and so they're in the front lines working with the communities, and cashiers or working as nurses in healthcare. So there's many different reasons. However, the county executive mentioned we are seeing people who are COVID-19 from all parts of the county, from all professions, or including people that are staying at home, and so nobody is protected. And we know how to prevent infection, and we, as a community, we really have to think about changing the way we do things to stay healthy.
That was actually my question.
Michael?
Just looking for extra context on the 11 people who had died in the last week. Is that a result of just people throughout the community, or is it isolated at a place like a nursing home?
I don't have the answer to that question. All I know is that I think it was 10 of the 11 were over the age of 70 or older, and one was in their 50s. I don't have that. We could probably find out, but I'm not aware of it or being in relation to any particular location. Doc's going like this, so. Sandra?
The coalition for the New York Coalition for Open Government, as well as some county legislators, have expressed concerns about the lack of transparency regarding the sharing of nursing homes or other places of business where there might be COVID-19 outbreaks in Erie County. Just wondering whether that is your policy about not releasing that information is going to be changing at all.
The general rule has always been we'll release information if it has a direct impact and risk to the general public. We don't get always the information associated with every nursing home. Like we didn't even get the nursing home data the last couple of days. We've got just the hospital data from New York State. We don't get the data. They do not provide us the data, the nursing homes.
The state regulates.
The state controls it. They get the data, and then if we get it, they share it with us. The nursing homes do not give us any data directly. They never have, and they're not. They legally don't have to, but they have to the state. It's a question of whether the state releases it to us. So sometimes we don't even get the nursing home data.
But if you do get the data, you tend to say that HIPAA protects that information from being shared. I'm just wondering if that is still.
Well, it's also with regards to issues associated with, is there a risk to the general public? And if we believe there's a risk to the general public, we've talked about it, but we haven't really seen anything that's been a major risk to the general public. Not everybody's going to be happy with it, but.
So the fact that other counties are disclosing this information, but you guys aren't, is not something that.
Well, the other counties, I mean, listen, for the longest time, some of those other counties ignored that COVID even existed. And they would used to say, there's no problem down here. Whatever. They're not always the ones that are releasing it. Sometimes it's actually the nursing homes that are releasing it, and then the counties will just, we have something at a nursing home. But even they don't get the data. I've heard that repeatedly. They don't always get the data. Sometimes we had trouble early on getting hospital data, such that I talked to every one of the hospital leaders and said, I need you to provide your data to Erie County directly, because we're not always getting it from New York State early on. Eventually, when enough county executives squawked about it, we started getting the data on hospitals every day. We don't always get the data on nursing homes or some of the other assisted living facilities that they track. And there's been days in which we don't get it. And then if the state provides it to us, they provide it to us. If they don't, we don't have it, because no one's required to give it to us, and if we ask for them, they don't have to do that.
Your own contact tracers, though, might be able to identify nursing homes and places of business.
But we may not know exactly the number at any one time in a nursing home. So
in general, it's status quo as far as what information you're.
if there's a risk to the general public, we would announce it. Last question, Kelly.
The latest batch of cases, is it skewing towards any certain age group, or is it consistent with now it's more younger people than before and also older people on the two ends of the spectrum?
I don't think we actually had that by age group in here today. It's pretty.
I think it's like to the 20s.
It's still the 20s. The 29 is the highest. but it's not ridiculously higher. It just, at this point, we've gotten to a situation where it's just community spread. I was thinking of something else to say, but really there's nothing else to say. It's community spread. It's showing up in all different age ranges. We're still seeing less cases in the older adults. They're more vulnerable, so there's a greater risk for them with regards to hospitalization or deaths. I think those individuals are taking more less chances. They're the ones that are really not leaving the home or basically wearing masks, putting on gloves when they go out. It's general community spread. There's no one age group that's stronger or higher than the other, except for the 20 to 29-year-old. But it's not that much higher is what I've seen in the last week or 2 weeks data. It's not like it was a few weeks ago where it was so dominant. It was like 40% of the cases. With that, I want to thank everyone for tuning in to our presentation today. Once again, I want to thank Kendra Schmidt from Deaf Access Services providing the American Sign Language. Thank Dr. Burstein for the information. As we've noted, we are seeing some of the highest rates of COVID-19 transmission in Erie County in months. We are seeing some of the highest hospitalization numbers in Western New York in months. And unfortunately, this past week or so in Erie County, we saw the highest death rate in months. COVID-19 is not going away. This is not a hoax. This is something that we're going to be dealing with for the foreseeable future, at least until we have a vaccine in which 50% of the population has been vaccinated. And it doesn't look like we're going to have a vaccine for at least till middle 2021 before they could administer it. So I want everyone to understand, as we've said from the beginning, we are all in this together. I need each and every one of us to be our brothers and sisters' keeper, to be there to protect each other just like we protect ourselves. We wear masks not only to protect ourselves, but to protect others. Wash your hands. I find myself lately washing my hands more than I have since at least the first few months, as I realize COVID-19 is still there. We all get a little lax, but we all can do better. If we do that, we'll be better for it. I hate having to deal with why is Western New York, why is Erie County one of the highest in New York State questions I get, not just from media, but from New York State. And my response is because certain people in the community aren't taking it seriously. The vast majority of people are. If everyone did, our numbers would not be like they are today. So with that, hopefully next week, people will take this a little more seriously and we'll see some better numbers in the next week. Until then, be safe and well, everyone.